This condition is characterized by a pronounced fear of a wide range of public places. People who experience this disorder often fear that they will suffer a panic attack in a setting where escape might be difficult. Because of this fear, those with agoraphobia often avoid situations that might trigger an anxiety attack. In some cases, this avoidance behavior can reach a point where the individual is unable to even leave their own home. Agoraphobia is an anxiety disorder characterized by symptoms of anxiety in situations where the person perceives their environment to be unsafe with no easy way to escape. These situations can include open spaces, public transit, shopping centers, or simply being outside their home. The symptoms occur nearly every time the situation is encountered and last for more than 6 months. Other conditions that can produce similar symptoms include separation anxiety, post-traumatic stress disorder, and major depressive disorder. Agoraphobia is a condition where sufferers become anxious in unfamiliar environments or where they perceive that they have little control. Triggers for this anxiety may include wide open spaces, crowds, or traveling. Most of the time they avoid these areas and stay in the comfort of their safe haven, usually their home. In these cases, the sufferer is fearful of a particular place because they have experienced a panic attack at the same location at a previous time. Fearing the onset of another panic attack, the sufferer is fearful or even avoids a location. Some refuse to leave their homes even in medical emergencies because the fear of being outside of their comfort areas is too great. The sufferers can sometimes go to great lengths to avoid the locations where they have experienced the onset of a panic attack. Agoraphobics may suffer from temporary separation, anxiety disorder when certain other individuals of the household depart from the residence temporarily, such as a parent or spouse, or when the agoraphobic is left home alone. Such temporary conditions can result in an increase in anxiety or a panic attack or feeling the need to separate themselves from family or maybe friends. People with agoraphobia sometimes fear waiting outside for long periods of time. That symptom can be called macrophobia. Many patients report a fear of dying, fear of losing control of emotions or fear of losing control of behaviors. Likewise, they may be confused by sloping or irregular surfaces. Chronic use of tranquilizers and sleeping pills such as benzodiazepines has been linked to onset of agoraphobia. Most people who present to mental health specialists develop agoraphobia after the onset of panic disorder. Early treatment of panic disorder can often prevent agoraphobia. Agoraphobia is typically determined when symptoms are worse than panic disorder, but also do not meet the criteria for other anxiety disorders such as depression. In rare cases where agoraphobics do not meet the criteria used to diagnose panic disorder, the formal diagnosis of agoraphobia without history of panic disorder is used. Antidepressant medications most commonly used to treat agoraphobia are mainly selective serotonin reuptake inhibitors. Eye movement desensitization and reprocessing has been studied as a possible treatment for agoraphobia. Remember, you don't have to see the whole staircase. Just take the first step and be proud of it.